One of the areas that we encounter in healthcare is understanding that personal characteristics and ethnicity and race are key parts in the quality of the care that we give.
The Sheffield Health and Social Care NHS Foundation Trust hasn't been consistent in the way that it looks after communities that are marginalised by race and/or ethnicity.
We already know that we're missing 40% of data on ethnicity, so it's reasonable to assume that that 40% is from communities marginalised by race.
Over 40%, particularly of Black British, African Caribbean people, were being overly restricted in our environments, and yet there was nearly another 40% of people whose ethnicity we didn't know.
For some communities, there was a sense that the NHS only came out and spoke to them when race was the flavour of the month, or when there'd been quite a high-profile campaign around ethnicity.
On those early conversations with communities about race, it was a really hot topic. It became evident very quickly that we had blown hot and cold around the importance of race.
What we were hearing from communities marginalised by ethnicity was a real lack of trust in institutions. In a mental health setting, this is really difficult because it was leading to people not accessing support when they needed it, or actually only going into mental health care when they hit crisis.
One of the conversations we had was around our use of restricted practices and how evident it was that certain communities marginalised by their ethnicity were overrepresented in that data.
How could we expect to make our service users feel at home in our services without understanding what their idea of home is?
The Patient and Carer Race Equality Framework is an organisational framework that we are developing in Sheffield to make sure we are being culturally appropriate and culturally sensitive to all our citizens in Sheffield.
What we've heard from the conversations that we've had with our community leaders, with our service users and carers, with our staff members from racialised communities and those who have other protected characteristics is the importance of really knowing the richness that people bring, and it's something that is really central to their being.
We need to be more comfortable asking these questions on ethnicity and cultural backgrounds. Otherwise, how could we expect to give good quality care in our services?
An example of asking the question around ethnicity would be to start that conversation by saying, so tell me a little bit about your culture.
How do you racially or ethnically identify?
Tell me a little bit about your country.
What is your racial or ethnic identity?
Tell me a little bit about your family, and start to have that conversation.
Show them the bit of paper if you need to and ask them how they define themselves. It also gives them the opportunity to tick the boxes around their sexuality, if they're disabled, and other protected characteristics that we're also missing data on.
So the more culturally curious we are as staff, the better understanding that we have of the people who are coming into our services from racialised communities, the better care we will give, and also we gain a more agile way of working.
So not only is it about reading the room, don't make the assumption of where they are from. They're proud of their culture and heritage.
The more we know and the deeper our understanding, the more comfortable we are with asking these questions, because these are a part of people's everyday life and their experience.
Never make the assumptions and never not ask the questions.
We need to be more comfortable asking these questions to our service users, understanding what these cultural impacts have, and only in that way will we know how to give good quality care.